Let's now bring in Dr. Samantha Green, family physician and president-elect, Canadian Association of Physicians for the Environment. Dr. Green, thank you for your time. I appreciate it.
Thanks for having me.
So what is it about the air quality right now which is so harmful to breathe?
The pollution from wildfire smoke is a soup of toxins, all kinds of things mixed in there. And what really is harmful to our health are the tiny little PM 2.5, so particulate matter 2.5. And the issue with those particles, which can be made up of a whole range of chemicals, is that they are so small that they not only cause irritation to the nose, the eyes, the mouth, but also they get into the airways and then they can actually get into the bloodstream. And within an hour of exposure to this kind of level of wildfire smoke, we can measure inflammation throughout the body.
What are the long-term impacts of inhaling such air for days at a stretch like we are at the moment?
There's very little known actually about the long-term impacts of wildfire smoke, but there's a lot that we know about the long-term impacts of air pollution. And air pollution causes harm throughout the body, and it is a cumulative impact. So if you're stepping outside for a few minutes, that shouldn't be a problem. It's more an issue if you're spending lots of time outside, and for people who, for example, work outside, people experiencing homelessness, it's in particular harmful. What can happen is it can trigger the development of lung disease. It can worsen lung disease. It can also trigger worsening of heart disease. And over the long term, we know that exposure to air pollution can cause certain kinds of cancer, can contribute to dementia, can cause poor outcomes in pregnant women, including low birth weight, can even trigger diabetes, and can cause some mental health impacts as well. I mean, there's the anxiety of looking outside and seeing the orange skies, but actually it can contribute to things like ADHD.
What should people be doing to remain safe at the moment? Those, of course, who are working outdoors have little choice. We know that, for example, schools have cancelled outdoor activities, but people who are at home, who are often opening their doors and windows for letting ventilation happen, what would your advice be right now?
Yeah, keep those windows and doors closed. If you have a HEPA filter, turn it on, like a standalone air filtration device. Make sure you have a filter on whatever HVAC system you have. An air conditioner, it's a good idea to turn it on. It can help with the indoor air quality. Keep the vents off, so your bathroom vent can actually pull in outdoor air. The vent above your stove, use it when you're cooking, but otherwise keep it turned off. If you're stepping outside, an N95 can help, but try to stay inside and reschedule any rigorous exercise, for example, and pay particular attention if you do have an underlying health condition like asthma.
All right, we leave it at that for now. Dr. Samantha Green, family physician and president-elect, Canadian Association of Physicians for the Environment. Thank you so much for your time.